Hello and welcome to my channel. So today I'd like to do a video on acupressure points that can be used for back pain. I love treating back pain, second to perhaps knee pain. It's really great to do any painful condition. I just enjoy getting people out of pain. What more can I say? So back pain is something that I treat very often in my clinic, and there are several strategies that can work here. If one doesn't work, well, we just shift to another one with the goal to get relief, hopefully at least 80% relief within the session while you're still on the treatment table. So that's the framework that I operate in. Sometimes I will use scalp acupuncture, distal acupuncture, perhaps abdominal acupuncture, ear acupuncture, moxibustion, and massage, and as well as any combination of the above. But for today, I just want to show you a few of the common points that you can use on yourself at home with acupressure, and that you will likely find that one or two of these points will do the trick. And so let's give these a try and see how it goes. So let's just talk a little bit about the reasons for back pain and the types of back pain. So one of the first things we look at is, where is the back pain located? Is it upper, middle, or lower back? This reveals a lot because there are a number of pressure points running down the back that give us some clues as to the reason for the back pain. In Oriental medicine, the back and torso area are divided into three sections. These are called the three burners: the upper burner, middle burner, and lower burner. It's called the San Jiao in Chinese. So the upper back is where we find points connecting to the organs of the upper body, which are the heart, the lung, and the pericardium systems. The lung system functions to disperse and spread qi and body fluids like a mist that moistens the skin and regulates the opening and closing of the pores. It also regulates sweating. When this function is disrupted, such as in the case of catching a cold, there may be symptoms such as swelling of the cheeks, pain on the outside of the eye, the outer canthus, sore throat, and yellow tongue coating. One of my teachers, Tak Sodasaki, likes to call the upper back area the heaven area because he explained that the organ systems of the upper back have to do with our connection to the divine. So people can get upper back pain when there are issues with the connection to heaven, however that might look for us. The lung system has to do with our ability to let go of what we no longer need and to take in inspiration from a higher source. This is similar to our ability to inhale and exhale air. The pericardium system, which is a membrane that surrounds and protects the heart, has to do with our sense of being able to feel safe, especially in our social world, and to connect with others. The heart system is about being able to understand our true self, who we really are at the deepest level. Now then we get to the middle back. We have points connecting to organs of the middle torso. So these organs are the liver, the gallbladder, the spleen, and the stomach. These organs have to do with our digestion of food and the energy that we gain as a result of breaking down the food, preparing foods for processing further along the digestive tract, or what we call the rotting and ripening function of the stomach. So any issue with these organs, such as nausea, belching, overeating leading to fullness in the stomach, any of these can create tension, tightness, and pain in the mid-back. Now, this, of course, is a gross oversimplification because we can have referred pain that moves from other areas. So we can't always read it in this simple way. We have to watch if the pain moves back to its point of origin with treatment. But in any case, it's a starting point because what often happens with treatment, acupuncture treatment, it's similar to peeling an onion. So as the pain starts to clear, we find that it moves, and it will move in a logical, progressive way back to the original starting point where the problem really is. So, for example, I often have patients that come in with a vague, diffuse kind of shooting pain from the hip down through to the leg. And once we start to clear the pain out of the leg, it starts to be just about the hip. And then when we clear the hip pain, it starts to be just about the low back. And then, I often find out that they've had low back pain in the past that never got resolved. So this is a common pattern. Once we start to get to the root of the issue, then things die down and we get resolution of the pain. I often see middle back pain in people who have to sit at a desk all day. Maybe they're on the computer a lot, or, just aspects of their lifestyle are just very more sedentary, just not moving their body around enough. Some people also tend to just store their stress in their midsection, in their stomach area, which can lead to mid-back pain. So lack of movement creates stagnation in the body. And the old axiom in Oriental medicine, where there is blocked qi, there is pain. Where the qi flows, there is no pain. This is always the guiding principle when treating pain, to restore the healthy flow of energy to the area where it got stuck. Now, when we get to acupuncture or acupressure, the type that I do is called distal acupuncture because it's especially useful for any kind of pain. And the bonus is that we don't have to put any needles into the painful area, and most people are quite happy about that. And the reason it works is that each acupuncture point has various functions in the body. So when we stimulate these points with either acupuncture or acupressure or moxibustion, which is a type of localized heat treatment, we're basically telling the body to make its own medicine, to send more blood, oxygen, and nutrients to the intended area. With lower back pain, we need to consider the organs of the lower torso, which are the kidney, the bladder, the small intestine, and large intestine systems. Any issue with these organ systems, which are responsible for transforming, sorting the pure from the impure, and then excreting the impure from the body. Any issues with these? Now, with the kidneys and the bladder, they are harmed by cold. So if there's been cold exposure, such as not wearing enough warm clothing around the low back and low abdomen, or being outside a lot in the winter, when this has happened, I recommend applying heat. For example, a hot water bottle, taking a hot bath. It may take a few tries, but if this cold exposure is the actual cause, then just persist until you see some shift. A faster way to do heat treatment is with moxibustion. The heat is much stronger with Japanese-style moxibustion, and your skin is protected by a layer of moxa cream, which is a thick paste made out of beeswax and herbs, which protects your skin so the heat gets absorbed deep into the tissue without harming your skin. Low back pain is also quite common because many times it is linked to a kidney deficiency, and almost no one in our modern world has a strong kidney system. And this has many reasons. The weakness in the kidney system in modern times has to do, first of all, with our genetics, because the kidney system is the repository of our genetic inheritance from our parents, grandparents, and ancestors. And because generally speaking, the strength of our genes has been declining for several generations, we have only to look at the work of Dr. Weston A. Price, who was a dentist and researcher at the turn of the 20th century. His claim to fame was that he went around the world and studied the facial and jaw structure of the health of people's teeth in many different cultural groups and tribal populations. So everywhere from, the Canadian Arctic to the Aboriginal cultures in Australia to, fishing villages in Scotland. He went all over the world. So he studied these cultural groups and tribal populations who were eating a traditional diet, a diet free from processed foods. Mostly just local foods that they had grown themselves or, scavenged for themselves. And you can see a definite decline in the facial structure from these pictures. And he compared them to people that were living in cities and eating a more processed diet. And so what you see is a pattern where the modern people are developing a more narrow jaw structure that doesn't hold our full 32 teeth properly. People are getting, crooked teeth, decaying teeth, and the teeth and bones are connected to the kidney system. They are governed by the kidney system in Oriental medicine. And we can also see that the fertility rates are declining in modern times. So in Oriental medicine, the kidney system is also responsible for the reproductive system. Okay, so I'm going to stop there because I could, go on for a long time. So let's get to the topic of this video. So some acupressure points that I want to show you today, many of them are on the hand. And this is great because you can easily work with these points wherever you are. And for people getting acupuncture, they don't need to disrobe. So now if your back pain is one-sided, you're going to use your opposite hand, the hand opposite your back pain. If it's just central, then we can use either side. Now this first set of points is called Lingu and Dabai. This is what we call a Dao Ma, which is a set of points where the using all the points is more powerful than just using any of them individually. So this first point, Lingu, is located on the dorsum of the hand, and it comes from the acupuncture lineage of Master Tung, to whom I'm infinitely grateful for, and all of the teachers of this lineage that I learned from, Dr. Tan, Brad Wisnett, and others, for providing me so much of their expert advice. So Lingu is also, I should mention, is contraindicated in pregnancy. Okay, so it's located on the dorsum of the hand in the junction of the thumb finger and the index finger. So just going right into the webbing between these two fingers and going right down close to the joint. This point is famous for its use for sciatica pain as well as lumbar pain. And then this point is often paired with a point called Dabai, which is on the same channel. This is the large intestine channel we're on here, and just going further up to the base of the fingers, so just in a depression proximal to the metacarpophalangeal joint. Okay, so just below this index finger, where the index finger meets the metacarpal bone, just under this point here, and you're going pretty close to the bone. Now, I would try to work these 2 points together because, like I said, it creates a Dao Ma. The effect of them both together is more powerful. So, for instance, you could just start with Lingu, pressing here for a minute or two, and then go to Dabai, press for a minute or two, then back to Lingu, and just more or less like this, back and forth. And so they will be activated at more or less the same time. And then what we're going to do is we're going to go over to the side of the hand on the outside here. This is called the small intestine channel. And we're going to look at a couple of points here. This one just below the pinky finger is called small intestine 3. So we're going to find this point by just making a loose fist, and this point is on the ulnar aspect of the hand. So this point is proximal, meaning like closer to your heart, at the junction of the 5th metacarpal phalangeal joint, and it's at the end of the transverse crease, right in here, at the junction of the red and white skin. Okay, so when you make a loose fist, there'll be a little bit of a bulge there, and you just want to press right into that point. This point benefits the neck and the back. It also opens up the channel that runs down the spine, the governing vessel channel. It also calms the mind. It treats manic psychosis, epilepsy, and interestingly enough, it also helps with deafness. The small intestine channel runs through the ear. Okay, and then, so this point is more upper back, neck and upper back. And then we're going to move down to a point called small intestine 4. This is on the same side of the hand, in the depression between the 5th metacarpal bone and the hamate bone. So if you just press in here, you'll find these two bones. You can do a little internet search if you want to get more clarity on that. And so in the same way, just at the junction of the red and white skin. So this small intestine 4 point treats back pain due to deficiency of the kidney system, as we can see from this master tongue hand map. This point treats lumbar pain, and the one way that I can explain why these 2 points do what they do is to understand how the spine is mapped onto the 5th metacarpal bone. So this being the top of the spine here at small intestine 3, so top of the spine, we have neck and upper back. And then down at the base here, this is also mirroring the base of the back, so the low back. And then we're going to go over to the back of the hand again, and we're going to find 2 points. These points are both given the name Yao Tang Shui, at the base between the metacarpal bones, just in the depression between these bones. This point treats acute lumbar sprains. So if you just hurt your back by lifting a really heavy box, something like that, you will often find one of these points is going to be sore. So you can check 2 points on the right, 2 points on the left. You've got four to choose from. So just press into these points and see if you feel a little bit of tenderness. And then where you feel that tenderness, that's where you're going to do your acupressure. Now for middle back pain, you can try a point on the front of the body called Ren 12. This is a case where the front treats the back. Okay, so that's one of the principles in master tongue acupuncture. Now, Ren 12 is a point that benefits both the spleen and the stomach, which may be at the root of the mid-back pain. This point is tender on a lot of people. It's a point found on the anterior midline of the upper abdomen, so it's halfway between the umbilicus, that's your belly button, and the sternocostal angle, so that's this point here between the 2 ribs. This point treats all manner of issues to do with the spleen and stomach, such as epigastric pain, abdominal distension, vomiting, dyspepsia, hiccups, acid regurgitation, diarrhea, jaundice, anything going wrong in the midsection. This is a great place to start. This point functions to harmonize and strengthen the spleen and the stomach, the whole middle jiao, the middle burner. It also calms and strengthens the spirit. And then finally, I want to show you some points on the ear. So I like to do auricular acupuncture for back pain. So I'm just going to show you a picture here that maps the body onto the ear. So looking at this picture, you can see where the neck and the upper, middle, and then the sacral area of the back are by these markings here. So these points are mapped onto the antihelix of the ear. And what I often do with people having back or neck pain is just applying some pressure here and finding the sore spots. These will correspond to the exact location where the pain is on the back. So then we can use press seeds or press tacks on those sore spots, which then people can wear home, and they can do the acupressure here, pressing those seeds. You can also make your own press seeds using a mustard seed on a piece of medical tape. That's basically how they're made. Now, if you want to get really fancy and fun, you can use tiny quartz crystals on the medical tape, tape it onto the painful spot on your ear. So you can press along this area just to find out where or if you have any tender spots, and that's where you're going to put the pressure. You will want to use firm pressure right into the cartilage of the antihelix. So you're pressing right into the hard ridge. It feels bony, but it's actually just cartilage. Okay, so thank you for joining me here. I hope this has been helpful to you and that your back pain starts to go away. And I look forward to joining you again in the next video. Thank you.